Hello, everyone. Good morning. Good afternoon, I should say. I'm Mona Masri, and today I'm representing the Asset Funders Network. And I'm so excited to welcome you to our webinar, Why Care About Care? Intersectional and Intergenerational Policy Solutions for an Equitable Care Economy in a New World. I just want to go over some quick housekeeping. For those of you who aren't familiar with GoToWebinar, if you have a question, please ask your question in the box on the right-hand side of your screen. I will facilitate a Q&A period after the presenters speak. And I also want to provide a friendly reminder that any questions should be focused on policy and not politics. So please frame your questions and perspectives in a way that's respectful to all participants. And so at this time, it's my honor to introduce our moderator, Padmini Parthasarathi, who is the Senior Program Program Officer for Economic Security for the Walter and Elise Haas Fund. We're so glad to have you here with us today. And without further ado, I'll turn it over to Padmini.
Thanks, Mona. And thank you all for joining us today. We hope that you're safe and well, and we really appreciate your patience as we've gone throughout the day and for joining us for this virtual session. So today's session, as you heard from Mona, is going to be focused on the care economy, which is an intersectional and intergenerational issue. It's made up of childcare, early childhood education, paid family leave, and long-term care for older adults and people with disabilities. And there are major gaps in policy around these issues, leading to racial, gender, and economic equities for the caring workforce and unpaid caregivers who aren't even included in most government definitions of work, and also inequities in access, affordability, and availability of care. And as we've all seen and we've heard in sessions this morning, the COVID-19 pandemic is exacerbating these deep inequities and public policy failures. A New York Times article on Saturday about the fact that most essential workers on women said, this care workforce is part of the infrastructure of our whole society. It holds everything together, yet it's long been undervalued, a neglect that's as obvious as ever right now. And I thought that really encapsulated the issue well, and is why we're glad we get to talk with you today. We know that home health and personal care aides, jobs that earn little more than minimum wage, and until recently were even exempt from basic labor protections, are two of the fastest growing occupations in the entire US job market. More than 8 in 10 of these aides are women. On average, childcare costs are 10% of the household income of two-parent households and 37% of the average single-parent household's income. 1 in 6 working adults are providing care for a family member over 65, and a quarter are caring for both children and older adults. We know that our aging population is growing rapidly. Currently, nearly 6 million Californians are over the age of 65, and by the mid-2030s, California's 65 plus population will have grown by more than 65%. And in a decade, we also know that no ethnic group or racial group is projected to comprise a majority of California's seniors. So we already have a really diverse population of seniors, and that will continue to happen as we move into the next decade. We also know that the number of California seniors who will have difficulty caring for themselves will double to more than 1 million by 2030. And in terms of some of the state-funded services for caregiving, like in-home supportive services for older adults and people with disabilities, that program costs about $4 billion a year and is expected to grow 11% annually, which makes it one of the fastest growing and costliest in the state. Transforming our care economy because of these data was already one of the most urgent critical issues of our time before the pandemic. And now with the pandemic shining a bright light on this challenge, we now have an opportunity to act boldly and with urgency and not only meet, but seize this moment with both hands. We hope that as you listen to our stellar panel today, you'll hear how you can engage in this social change effort, regardless of what kind of funder you are and whether you focus on children, women, immigrants, racial justice, older adults, economic security, health, or any other issue or population. We also hope that you'll be able to begin seeing where you can collaborate across sectors and with your peers in the funding community and your nonprofit partners to advance care economy policy solutions. So with that, I'm really happy to introduce our panelists today. We have Amber Christ, who's directing attorney for the health team for justice and aging. Leah Austin, director of the Center for the Study of Childcare Employment at UC Berkeley, and Katie Bethel, executive director for paid leave for the United States, or PLUS as they're known. The format for our session will be that I'll be posing a couple rounds of questions to our panelists, and then we will open it up to all of you for a Q&A session. Just again, as Mona said, please submit any questions you have in the chat box. And just a reminder that you'll be muted throughout the session. So with that, I'm going to turn to our panelists. So our first question is for Amber. So Amber, in your role at Justice and Aging, what are you seeing around the intersectionality of this issue related to senior poverty and how it's been impacted by the current pandemic?
Thanks, Padmini, and thanks for having me here. If you'll turn to the next slide, just to set some context. Next slide. There we go. So older women are far more likely to be living in poverty compared to men. As you can see in this graph, 50% of women are living in poverty compared to 40% of men. And we also see here that the older you get, the more likely you are to live in poverty. And that makes a lot of sense because your costs are going up, particularly your healthcare costs, but your income is not going up. It remains pretty fixed for folks. And if you move to the next slide.
This smells pretty good.
There we go. The rates of poverty are really much higher among older women of color. And this graph shows that older women of color, Black women, Hispanic women, and Native women are 2 times more likely to live in poverty than white women. And that is very striking. So more race, or more accurately, it's racism that is leading to these higher rates of poverty among older women of color. If we go to the next slide, I kind of want to demonstrate sort of these intersecting realities for folks. So there we go. We don't live in isolation, right? And so there are these compounding, intersecting systems and policies and events that happen in someone's lifetime that really compounds the impact and the likelihood that someone's going to age into poverty. So if we take, for example, a Black woman who was born in 1939, it wasn't until she was 15 years old that schools became desegregated, and that wasn't like a light switch. Policies just don't turn on. The Civil Rights Act didn't pass until 1964, so it was, quote, separate but equal until she was 25. The equal right to vote wasn't until 1965. We had in 1972, we had the Fair Housing Act in 1968, so there was still housing discrimination allowed, and of course that again still has not gone away. 1972 is Title IX and equal access to education for women, and she was 33 by that time, so probably wasn't seeking secondary education or graduate education at age 33, so she kind of missed that window. 1978, she was 39. That's when pregnancy protections went into place, that you can't be discriminated against in the workplace based on being pregnant, so probably also missed that window. If she had a disability, it wasn't until she was 51 that the Americans with Disabilities Act was passed. And then in 2009, we saw the Great Recession. And we know that that disproportionately impacted women of color. And if she had owned a house at that time, she probably lost all of the equity in her house. And now we're in 2020, she's 81 years old, and we have this COVID crisis that just hit. So she is in the group that is most at risk for serious illness from COVID. And she's also probably relying on either a family member for help in her household, or she's residing in a nursing facility, which is a very scary place to be. So we see these compounding, intersecting policies and systems really kind of ensuring. It's actually kind of remarkable that women, particularly women of color, aren't all living in poverty based on these compounding systems of policies. So we're really seeing that play out. And if we look at caregiving and how caregiving kind of fits into the equation, caregiving acts as a huge driver of poverty. And it's not really the caregiving itself, but the fact that we have all of these policies in place that significantly undervalue caregiving. And the reason as society has undervalued caregiving is because this work is predominantly done by women and predominantly women of color. So we are either undervaluing the pay of that work, not paying at all. So it's not that the jobs warrant lower pay, but it's as society we're paying lower wages or not paying at all. So if we look back at our 81-year-old and whether she acted as a caregiver in her lifetime, what that means is that she probably took out time from the workforce or significantly reduced her hours in the workforce to care for her own children. She likely cared for aging parents or relatives, also taking out time from the workforce, and as a result paid less into retirement and predominantly into Social Security. Social Security is the main source of income for women of color. I think 88% of their income in retirement is Social Security income. And you really see this play out. So you have Social Security benefits for women are $300 less than they are for men in retirement. So that's equates to about $3,600 a year less. And for Black women, it's $400 less a month in Social Security compared to white men. So we really do see this fiscal financial impact on women's economic security as they age. And when we kind of put this all together and we think about the long-term care aging space, so long-term services and supports, over the last few generations or decades, we've seen sort of some formalization in long-term care where, you know, in the 20s and 30s, almost all long-term care was unpaid. And now we're seeing that we're creating some formal systems of long-term care. So through Medicaid funding, we still don't have it in Medicare. And so it's super inadequate. Right now, the formal long-term care system only meets 1/3 of the needs of care in the US. And also to access that care system, you have to spend down to poverty in order to access it. And the jobs, these caregiving jobs are inadequately paying the caregivers. So even in the formal system, as we heard Padmini say, that individuals are hardly making above minimum wage. And now there's this kind of re-emerging trend that we're kind of going backwards, where there's becoming less formal caregiving. And what we see really happening now then with COVID is that this is kind of going to exacerbate and really accelerate this kind of back to more family and unpaid caregiving, which will only exacerbate the number of women who are going to age into poverty. So you see women working 2 jobs as caregivers, and now they can only work 1 because they can't transmit, can't work in 2 different facilities because of COVID related. You see that women are less likely to have paid leave, so they leave the workforce right now because they have to, and they're not getting the same kind of paid leave. And then states are going to be more strapped for funding. And unfortunately, the formal paid leave system is funded predominantly by Medicaid, but home and community-based services in the Medicaid program are optional. And so that means that states can cut those benefits when they're facing a budget shortfall. And all states are going to be facing a budget shortfall. So we're afraid that what will happen is that HCBS will be cut, which means that that's going to mean that more, and because women are predominant caregivers, it means that more women will have to leave the workforce to provide caregiving, or conversely, we'll have a lot of older adults and people with disabilities going without needed care. So we really see this COVID crisis exacerbating and accelerating what is already a crisis in caregiving. And if we don't have policies that address it, will become really just catastrophic.
Thank you, Amber, for laying out the issue around, the intersections between older age and women of color and the gender and race issues. And then we also see issues with the care economy on the other end of the age spectrum. So my next question is for Leah. What are you seeing around the intersectionality of this issue related to early education and the childcare workforce, and how this sector has been impacted by the current crisis?
Sure. And thank you. I appreciate the opportunity to be here and be part of this conversation. And so I'm going to focus my comments and information here on the early care and education workforce. So those who are working with children typically up until they enter kindergarten, or in the case of California, that might be transitional kindergarten. And as Amber said, the work of care is undervalued, and we see in the work of caring for and educating young children the historical and pervasive undervaluing of labor performed by women and minorities combined to create one of the most underpaid workforces in the country. In California, we know there are about 120,000 people who are paid to provide early care and education services in home and in center-based settings. There are many more who are providing unpaid work, but nearly all of these workers are women. You can see on the slide there, about 97% working in center-based, and most of those who work in family childcare we know are women as well. And we know that many members of this workforce are also immigrants. Oh, I forgot to say next slide. Sorry, there we go. Many members of this workforce are also immigrants. In California, those are the data you're looking at on the screen now. A little more than half of those who are working in home-based settings, and 29% of those who are working in centers are immigrants. And again, most of them are women. Next slide. Next slide. Did it go? Okay, thank you. Overall, the majority of this workforce are women of color, and among those in California, most are Latinx. So you see that what you're looking at here is the center-based workforce on the left, and those who are identified as home-based listed in the middle. We think those, the way they're classified, are typically your licensed family childcare providers, and then in the box, those are typically like your family, friend, and neighbor, people providing one-on-one services to an individual family. And our home-based workforce is even more likely to be women of color in California. Next slide. One of the things about our workforce in California that we know, even though qualifications for this work in statute are relatively low, that this workforce has much more education and training than is required of them. But despite these high levels of education, so for example, about 2/3 of those who are working in centers and about 1/3 in home-based programs already have a college degree. And for center-based providers, about 1/3 of those are people with bachelor's degrees. But despite this, they remain incredibly low paid, as you can see, earning $12.29 an hour for those who are classified as childcare workers, and a little over $16 for those who are identified as preschool teachers. And I would just note that these are not my categories of choice. These are really kind of, I would say, a false division. Children don't suddenly stop learning, at the end of a day, or when they suddenly turn 4 and they're ready to learn and be in something called preschool. But these are just federal government categories that we have to work with for data collection. But in any event, you can see that the wages are incredibly low, and they're well below the median wages of all workers in the state. And one indicator of how low their wages are is that we see that over half of this workforce reside in households that utilize at least one federal income support. And this is a rate that's more than double that of all other workers. They're also twice as likely as other California workers, and 6 times as likely as K-12 teachers to be living in poverty in the state. Next slide. it is also the case within the workforce that's underpaid and undervalued as a whole, that we see disparities that we know place some early educators at even greater risk of economic insecurity. This centers largely on the age of a child or group of children that a person works with, and on their own race and ethnicity. The younger the child, the lower the pay. This is true across the country, and it's true here in California. We have found that those who are working with infants and toddlers are paid less than those who are working with preschool age children. And that's the case even when they have the same level of education. And so that difference can amount to more than $6,000 a year. And as Amber was talking about retirement earnings and who, those discrepancies later in life, this certainly has an impact that these lower wages and disparities will follow these workers into retirement. Next slide. We've also identified evidence of racial wage gaps, and there is not a single wage gap. It really depends on where you are. Oftentimes there are multiple gaps. In California, we see this particularly for African American women who are working in early care and education, that they're earning less than their peers across education levels, and based on the age of children they work with. And so the result is that Black early educators are much more likely than their peers to be living in poverty. And across this workforce, especially for women of color, we find that there are many consequences of these low wages and insecurity. We find in studies we've done here in California and elsewhere, there's, people are worrying about basic expenses like food and housing, that they're forgoing their own health care procedures or for their family because of cost or inadequate coverage. Next slide. And so certainly in the face of the COVID pandemic, we can imagine that these conditions are only getting worse. We have been tracking what's happening in California and across the states to the sector as a whole and to the workforce. And I just have to say I am incredibly alarmed at how invisible this workforce is. And I think that's why likely of caregivers across occupations. But we see that as nearly, all schools have closed and we're all being called upon to social distance, that most states, including California, are actually encouraging childcare programs to stay open and to serve children of essential workers, though they're not often seen as essential themselves. And the policies that allow them to do this and encourage them aren't necessarily taking into account the well-being of these educators or the realities of what it means to work with children and babies and toddlers that don't do social distancing. And without other financial options, programs are going to try and stay open, and staff will continue to show up, or they risk losing their livelihood, even though they're placing their own families at risk. So we have been conducting a study here in California to understand what's happening. These are just some of our preliminary findings as of Friday. The survey is still open. But we see that our home-based providers, again, those who are most likely to be women of color, are more likely to remain open right now. Among those programs that are open, 43% indicate that without resources, if they were forced to close, they couldn't sustain their business for more than 2 weeks, and those would become permanent closures. And of great concern, 63% of programs that are open are reporting problems accessing personal protective equipment and the cleaning supplies that they need. So I think that this crisis has, not created these conditions, but it's exacerbated them, and it illustrates the pre-existing deficiencies that have really placed this workforce and their own families further at risk financially and physically. And I think I am out of time, so I'll stop there, and I think we'll come back to this issue a little bit later in the discussion.
Great, thank you, Leah. So I'm gonna move to Katie. So Katie, you started PLUS to focus on paid family leave. Could you share your policy goals with us and what this current moment means for the potential of this paid leave movement?
Yeah, absolutely. Thank you, Padmini. And thank you so much to Amber and Leah for your awesome laying out of this whole spectrum of the care workforce. One thing that we talk about a lot as we talk about care is the care economy. And I think that what we have learned in coronavirus, that those of us in this movement have known for a long time, but is now really clear to everyone in the country, is that care really is the economy. Care that we provide for each other, that we receive when we ourselves are ill, is one of the main engines behind having a functioning economy where everyone can thrive. And so as you're sort of listening to this panel and as this conversation continues, one thing that I hope everybody takes away is that this is a great awakening moment for the entire country about care. And family care, which is what paid family leave is really focusing on, just like the care workforce, is a non-negotiable part of that care ecosystem. So when we think about care, we think about everything from beginning of life to end of life. So right now in America, if you look at the beginning of life, today 1 in 4 people who give birth are back at work within 2 weeks of giving birth. So we as a nation, just from the very beginning of life, are failing to put the systems in place that allow for that most important initial attachment relationship to happen between parent and baby, and child to happen as sort of a foundational part of an individual's life. Then as you continue along that care continuum, people grow up, you have serious illnesses, there's childhood illnesses. A recent survey found that only 8% of grocery store workers, so just focusing in on one of those core frontline communities, workforces that is serving us today in coronavirus, only 8% of grocery store workers could take even 2 weeks off to recover from a serious illness. So that's just dealing with your own illness. Something that paid family leave covers. And then finally, as we move into adulthood, one of the core things that we do as members of a family, and that's family broadly construed, including chosen family, is care for others. So today in America, pre-coronavirus data, I think this is probably a much bigger number now, about 20% of our workforce has another part-time job, and that part-time job is called unpaid family caregiving. And think about that, that's 20 hours a week on average on top of a full-time job or a collection of part-time jobs, which is what many of our people in our workforce have. So just to tell a little story about how coronavirus is coming into play here, and how as the audience members on this call are thinking about care as a part of this emergency response that we need to do and long term. I'll tell you from my own nonprofit. So I have a part-time employee who's a mother of 2 small children, whose work for my organization is enabled by a paid childcare worker. And that childcare isn't available now. The childcare center has closed. My employee also has a spouse with a chronic illness, and that chronic illness is flaring up. And so what she's had to do as a result of coronavirus is go on family leave. And we're in California. And so because she has a family caregiving responsibility for her spouse, I, as a small business in this state, am able to have the pay for that employee supplemented by a family leave insurance program so that she can fulfill her caregiving responsibility and so that I can find someone to replace the work that she does for the period of time that she needs to cover that care. That's basically what family leave insurance is. So when we talk about policy design, in paid family leave, we're talking about a social insurance program. Other social insurance programs that you're familiar with, Social Security, obviously we heard about earlier from Amber, core support for families. Unemployment insurance is another social insurance model. We've had this kind of social insurance in California since it passed in 2002. California is the oldest state. When you think about design for this policy, you want to make sure it includes all types of family. You want to define family broadly, and that's especially important to make sure you're covering for different communities of color, and also the LGBTQ community. You also want to make sure you're covering all types of work. One thing that I was really excited to hear highlighted in the plenary session this morning by Sonia Diaz was the idea that our essential workers are those gig economy workers, are those workers at the very front lines, delivering our groceries, stocking the shelves, driving people to their doctor's appointments. These are the critical workers. And right now, many labor laws actually completely leave out that part of the workforce or have much more diminished rights for that workforce. So that's really important too as you look at policy design. And I think we'll talk a little bit later about what the sort of big opportunity is now. But I want to give you just one example. I just saw some new polling showing that paid family leave and issues of care overall are really coming to the fore in voters' minds today. New polling just showed that 2/3 of voters said that they would change their vote if they learned that their representative voted against care. So that's a really important new data point. Care and things like paid family leave, paid sick days, these policies are newly in the public's mind, and that makes it a key and urgent moment to act.
Great, thank you, Katie. And Katie did a great job getting us to start thinking about and talking about policy solutions. So that is where we're going to move to next. So I'm going to go back to Amber. So Amber, given the urgency that we have to address the current pandemic, particularly for older adults from your vantage point, what are some of the policy solutions that we should be looking at now? And also, what is in the master plan on aging, and does it address any of these policy issues?
Yeah, I'll start kind of with the master plan, just more because the master plan for aging is something that the governor committed to last year and had, and there have been all these work groups meeting, and so far there's been a report on long-term services and supports, but the actual master plan is not supposed to come out until October. So the main stakeholder advisory council for the master plan has sort of just really shifted, recognizing that we need immediate policy solutions. And some of those immediate policy solutions are already things that they were thinking about in the master plan, but there are also a bunch of new ones, and then there were kind of mid and long-term policy solutions that were going to be put forth in the plan. But I think most immediately, we are focusing in that plan and as an aging and disability community around making sure that there is Medicaid funding for home and community-based services. So we saw in some of these legislative packages that there's going to be increases to states for their Medicaid matching dollars from the federal government, and that's great. But there's no guarantee that those increased dollars are going to go towards home and community-based services, and we know that that's where the need is. We know that caregivers, direct caregivers, our in-home supportive services, our adult day health care, all of those services, they were inadequate to start, but with this crisis, everything has had to shift. So we really want to see targeted dollars towards HCBS. And that's really, if you think about that too, as I noted earlier, HCBS is an optional benefit. So states would cut that if they could. And we really, cutting it now means that more people are going to go into nursing homes, the most dangerous place to be right now because they're congregate settings. It's really hard to control the infection rate there. So what we really want to see are increases in HCBS dollars. I think too, paid leave policies, just, and Katie can talk far more about this, but the paid leave policies have to be better. They have to be more robust. They have to be more expansive in the sense that you can take off, say you have an adult like my mother, for example, I needed to take off work because her normal caregiver got sick or doesn't feel comfortable taking care of her, and now I have to leave the workforce because I need to care. That needs to be covered too, and that's currently not covered under the definition for the paid leave. I think Leah commented on this, the PPE, the protective gear that folks are getting, direct caregivers aren't getting that. They're not being prioritized, either in nursing facilities, they're not being prioritized. I just saw this weekend that IHSS providers for the first time got PPE. They're just not being prioritized, which means that we're increasing the risk, and we're also increasing the risk to the actual caregivers. And then kind of longer term, a policy solution, and I have lots that I can talk a lot more about, but I'll end on this one, is the creation of a new social insurance program, which would be a long-term care benefit. That is, that we're not forcing people into Medicaid and into poverty to access long-term services and supports, that we have a long-term care benefit that is available to every Californian. And there is a California Aging and Disability Alliance is working on that right now. And it seems even more critical today, as Katie so accurately put, like, our economy is care, and right now we have an enormous gap in that care. There is nothing funding caregiving other than our Medicaid program when you are an older adult or person with disability, and that is just an enormous gap that we need to fill. So I'll stop there.
Thank you, Amber. So looking again across the age spectrum and thinking about childcare and early childhood, Leah, I want to pose the same question to you around what the policy solutions are that we should be looking at in that space, especially given the current pandemic.
Sure. Well, I suppose we can see a silver lining if we want to look for one. I appreciate Katie's optimism about using this moment because it is making people more aware of the work of care and how essential workers are across these sectors. And so I think as people are worrying about access to childcare now and whether it will be there for others as we return to work, it does afford us the opportunity to speak to the fragility of the existing system and to include this workforce in broader discussions that are taking place about income inequality and its impact on workers and the disparate impact that this pandemic is having on low-income communities of color. And so I think that this provides an opening to call for and actually realize some comprehensive reforms that embed early care and education into the public infrastructure. And I think that's how we really, in order to get the conditions that we need for workers and access that we need for children and their families, we ultimately have to make this and fund it as a public good. You know, we are beginning to see, I think, recognition of this emerge in plans for future stimulus bills, for example, as some policymakers have called for targeted relief for the sector and its workforce. And I just want to point out, I think that's really important to talk about the workforce, not just programs and, you know, whether programs are operating or closing, but also what's happening to the individuals working in those programs. And so we've seen some language around the stimulus, for example, talking about that and talking about the workforce and calling out the economic insecurity that exists prior to this and calling for those emergency investments to lay the groundwork for the future of reform. But I think we also see, as we did, you know, we saw before this pandemic, that without kind of federal policy lever with investments and federal guidance, that states are just all over the place in making decisions and deciding what to prioritize and who gets prioritized, and the workforce being treated really differently and children and families having different levels of access. I think the one consistent thing that we have seen pre-pandemic and in the middle of this pandemic is that the programs that are publicly funded are faring better and their staff are faring better. That programs that have been able to close with resources right now that allow the businesses to meet their expenses, their operating expenses, and pay their staff while they're home, they will be able to open with more ease. And those are the publicly funded programs. And so I think that speaks to the need to establish a more robust public system and support for ECE and reduce this fragmentation we have. And here in California, we were just starting to embark on the creation of a master plan for early care and education. And I think there were really high hopes that this would bring comprehensive reform and investments. But we are hearing now, as other states are, like, don't expect too much, right? Because state budgets are being decimated by COVID. And, you know, it took nearly a decade for the state to recover funding for early care and education after the last recession. And I think our goal now should not be to return to pre-pandemic levels of investment, which are really insufficient, that we have to be much more bold and broad in how we're thinking about what the policy and funding goals are. And just really quickly, I was asked to consider what can funders do to support this work. And so I just want to briefly say, I think there's three things I would say. One is to support research and policy analysis that is really trying to understand the intersection of outcomes for children, families, and early educators, particularly with regard to disparities. I think we're often looking at kind of one piece, but really understanding what's happening at the intersection. And to really act with urgency for early educators and support advocacy work that is really bold and calling for comprehensive change. I think we can all appreciate that policy can be slow and incremental, but I think if nothing else, as we've heard, that this crisis has really demonstrated how harmful the current conditions are to the lives of people who are engaged in this work, and families also struggling to access services. And to support strategies that build the collective voice of early educators. Again, I continue to just be really alarmed about how invisible the workforce is. And I think part of that is that there's not a lot of opportunity for them as a whole to have a voice and to be able to, you know, to help elevate their own experiences. And so I think there's a great deal of work to be done in this regard in California and elsewhere.
Great, thank you, Leah. Sorry. And I'll just say, you know, I think it's always helpful for funders on our webinar to hear those recommendations. So thank you for that. And when we have Q&A, we could potentially get more into that area as well. And now, Katie, coming back to you, it would be great to hear more about what's happening around paid family leave, both nationally and here in California in response to the crisis. You started talking about the opportunities there are, so it would be good to hear more detail about that and what other policy recommendations we should be thinking about.
Thank you. So you can go to the next slide. So my guess is that a lot of the folks on this call have particular constituencies that you think about and serve when you're doing your work, when you're doing grant making. If there's one idea that you leave this session with from me, it's that you cannot separate the community you want to serve, the individuals you want to serve, from the community that supports them. And so whether you're thinking about young children, the elderly, cancer patients, whoever it is that you're trying to help, one of the best ways you can help them is by making sure that their family can give them the support that they need. And the enabler of that is it's all about work. Work is the thing that shapes adults' lives in America. And so if you're looking for ways to get people the support they need, you have to look at what is the workforce? What are the protections that people have? What are the rights that people have? Is the workforce, are the individuals in the workforce supporting the community I care about? are they actually empowered to act with power in their workplace to do the things that they need? At Plus, we've done extensive research about what paid leave policy looks like that enables the most people possible to provide that family caregiving support. And these are the key elements. 100% paid for lowest wage working families is extremely important. We already know that wages have stagnated in this country for decades. If we want to enable people to be there when it matters most, they have to receive full pay. In addition to that, we have to have a comprehensive view on care and family. We have to understand that there are all types of care that are needed and that are part of that care engine of the economy. And we also need to include all types of work. Many of the most important types of work that we're seeing right now in this COVID pandemic are parts of the labor force that have been left out of basic labor protections for years: domestic workers, farm workers. We have to correct that, and we have a chance with paid family leave policy to do that. And then finally, the social insurance model that I talked about. Next slide. So what I want to talk about here is the opportunity that we have in this moment, a terrible opportunity to have. Nobody wants to need a national crisis in order to advance a policy agenda. And also, it is incumbent upon us as fighters for social justice to make sure that we really own this narrative and really fight for what's needed. So I think as you're thinking about, how do I parse out family leave and care as I'm thinking about investments? I would break it into 3 categories. I would think about who's on the front line of this issue and do they have the support that they need? So who's left out of labor laws? Make some investments into those frontline workers and people who are most impacted. I would also look at investing in helping people access the support and policies that they already have, that have already passed. And that's where I'd look in California at organizations like Legal Aid at Work, the California Work Family Coalition, that are connecting people directly to the resources and support that they need to be able to care. And then finally, I would look at narrative and policy that leads to systemic changes. And in California, there's a huge role to play nationally, both as leaders in the policy space, but also as the home of many of our most important elected leaders. The California Coalition includes the Speaker of the House Minority Leader, the leaders of the Tri-Caucus. This is a place with a lot of political power. And it's funny, around the country, they'll say outsized political power. That's not true. It's the right size. We are the 5th largest economy in the world. It is appropriate that there's a lot of political power here. And as the people in California who are leveraging resources to create social change, we need to seize that power and move it forward. Next slide. So I want to make sure you leave with a clear sense of what's already happened and what needs to happen next. So at the federal level, what people are calling Package 2, which passed, it feels like a year ago, but was actually only a few weeks, the Families First Coronavirus Response Act. That applied to about 25% of the workforce. It carved out people who work at large employers and people who work at small employers. But it does allow for emergency sick days and paid family leave that's reimbursed to employers. So that's something that is really important for us to keep an eye on and to expand. Then in California, we also expanded the state paid leave program to include COVID-19 caregiving reasons. There are still people who are left out, unfortunately. but the coalition is working hard to keep that growing and better. And then the final piece is the CARES Act that is implemented through California unemployment insurance, but passed as a federal law. So I wasn't sure where to put it for you all in this slide. That expands the reasons that people can use unemployment insurance. And if you look at a family leave insurance proposal, this actually does some of what that would have done if it had already been in place. It makes it so that you can, as an independent contractor, apply for unemployment insurance, which has never been true before. And it also makes it so that if you need to miss work to care for a child who's missing school, you can apply for unemployment insurance even though you haven't lost your job. You can keep your job. So there's a lot of exciting policy here, and we've never had a better moment to advance policy, and I hope that we can seize it.
Great, thank you, Katie. So we now have time, we have about 10 minutes for Q&A. So just another reminder to please submit any questions you have in the chat box, and you can send them to where it says organizers and panelists. And I'm going to turn it over to Mona because she's been tracking the questions coming in and is going to field them to the group.
Thanks, Padmini. So first of all, I want to thank our speakers so much, Katie, Amber, Leah, and Padmini, for your great facilitation. Everybody's giving you a virtual clapping right now. Thank you so much. And just for folks on the phone, the PowerPoint is available in the handout section of the GoToWebinar control panel. And the recording will also be available after the webinar in case you missed any of it. So please feel free to also, when you list your question, if it's for a particular panelist, please indicate so. So I have a lot of questions, happy to start, but as you'd like, just kind of type your questions in the question box. So the first question is for Padmini. So what advice might you give a funder who's new to this space?
Yeah, that's a great question. And I think our panelists gave some really good examples already of how funders can engage. I mean, the first really basic thing, you know, I'm a relatively new funder in this space and have been trying to learn and strategize over the last, 9 months or so. And one of the first things I did was talk to the kind of folks we have here on our panel to really learn and understand the issue. There are a lot of great reports and resources. And we actually, I think there's going to be a way for us to share those after the conference today. So we will make sure to share those with all of you. And I will just point out one resource that I think is really interesting and gets to a lot of what Katie closed with around, building a broader social insurance system is some work on the concept of universal family care, which would be a social insurance program that would combine kind of what we've been doing piecemeal in some parts of the country, including in California, where you have a program for paid family leave. And then Amber talked about potentially a new program around long-term supports and services, but can we have kind of one social insurance program that would provide opportunities for taking leave or using leave, across the life course. And that report, a panel was convened by the National Academy for Social Insurance, and that report is out, and we'll share, that'll be one of the resources we share. I would just mention, to build on what the panelists already said about just the kinds of things local funders could engage in. I'm at a local foundation myself, and so these are really big issues that are often federal and state policy. We think about federal and state policy change, but I think there are ways that more local or regional funders can engage. I think a big way that was already mentioned is supporting outreach and education about the programs we have available in California. you know, the state does not provide funding for those things. And so really private philanthropy is key to making sure that people know what their existing rights are, whether it's around paid family leave or the new CalSavers, you know, retirement program that's available. And that requires outreach to both small businesses and other employers that might be in your local area, as well as individuals. There's a lot of local organizing and policy work happening around workers' rights, to the point that was made around "this is about work." And in California now, we have new law, AB 5, that classifies that deals with the misclassification of workers, particularly independent contractors, gig workers, domestic workers, you know, makes them eligible for these benefits that they may not have been eligible for before. So I'm supporting some of that local organizing work in San Francisco and Oakland around AB 5 implementation. And if you support direct services, you know, there are folks that provide legal services to people to help them, especially right now, claim unemployment, claim their paid family leave, especially with all of these changes, who are providing direct TA to entrepreneurs and small businesses around how they can access these programs and also connect their employees to these programs. We also have a paid sick day law in California that needs enforcement and is not actually fully being enforced in a lot of local areas. So those are just, you know, a few examples that I think, especially if you're a smaller funder, local, focused on direct service, that might be ways to engage.
Thanks, Padmini. So this question is kind of up to, I guess, any of the panelists. Can you talk a little bit more about what needs to happen around narrative change for this topic? I know you started it, Katie, so I don't know if you'd like to answer, but anybody can answer if you can share. We have a couple minutes.
And this actually gets to, I can bounce a little bit off of some of Padmini's recommendations as you're thinking about what you can do as a local funder who's investing in work at the local level that's more direct service oriented. The number one best thing that moves politicians in America, besides lobbying dollars, is the actual real stories of the people in their districts. And in the philanthropic community, I know there can be some discomfort with connecting the direct service work that you're supporting with the sort of call for federal or state policy, but it's well within the guidelines of C3 investments to find key stakeholders who can speak directly to their experience of these policies and bring them for education purposes to those legislators. So as an example, right now, small businesses are being left out of the reimbursable paid family leave and paid sick days policies that they passed at the federal level. Legislators, especially conservative ones, need to hear from those small businesses that that's a problem. And on the same token, people who have increased family caregiving responsibility, who work for large employers who have been left out of those policies, need to hear. So I think that's a really key way that you can contribute to narrative change from a position that also builds political will.
Great. So I know we have just a couple more minutes left, and I just want to ask, you know, one more, and I guess, Amber, this would be to you, if you can answer this quickly in kind of less than a minute. Can you just say a little bit more about the impact of asset limits on this issue being so important?
Yeah, so asset limits in our means tested programs are usually around $2,000, what basically means that we're keeping people, we make people spin down to poverty and then we keep them there. And that's even worse during this crisis because we have a lot of people in need, but we really don't, they're not going to need those benefits for a long term. So we're then going to force them into poverty, making it much more difficult for them to get out of poverty. So I think there's a lot of action to be done around increasing asset limits or suspending asset limits or eliminating asset limits in many of our means tested programs, because I think they're outdated anyway, and this is just showing that they just really do trap people in poverty. And I'll just take this one last thing. I don't know if Leah was going to say this, but funding data on the last question, the need for data and intersectional data is so critical to the narrative change. Right now, there's just such an absence there. And Leah mentioned it previously about kind of understanding the impact. And I don't think that we can do a lot in policy world without that data. So I really do recommend that as a funding priority.
Great, and that's perfect timing because we are out of time and I need to switch it after I thank you all again one more time for being such great panelists. Hopefully this isn't the last time that we have this conversation. We hope to engage funders and have more ongoing conversations to push this work forward. But I now want to turn it over to Fong to close us out.
Thank you. Thank you so much, Katie, Amber, and Leah, for all your just wisdom and shared information and opportunities for policy shift, as well as philanthropic opportunities. And to Padmini and Mona, you guys have been such great partners to NCG over the years, and just being advocates for the sector as a whole on what we can do for the care economy, as well as just economic security overall. So really appreciate it. Yeah, my name is Fong Kwok, and I am the acting co-CEO at Northern California Grantmakers. I am here to close out not only this session, but the whole summit day. And I really want to appreciate and thank you everyone for sticking it out with us for this full time. I know there were a lot of technology glitches, and I think that the fact that you're still on with us shows that philanthropy can really pivot and be nimble when needed. So I appreciate that so much. There were lots of questions that came in, and we didn't obviously get to have that much time, but we will provide those as follow-up resources and try to answer as many questions as possible following today's event. Just a few other notes. There were over 650 individuals who registered for today's programming. So that's the largest ever in Philanthropy California's history, and the first time we brought the three regionals together in this way. So congratulations for being a part of the historical event here. You will also be receiving resources and a survey in your inbox. So please take a moment to give us some feedback, as this will not be our last virtual event, and just ideas on how Philanthropy California can really serve you as a state. Want to note that our next philanthropy policy session will be on May 14th. It's on Schools and Communities First, which is the ballot measure that can drive over $12 billion to education, social services, and health clinics. The registration is on the Philanthropy California website, and it's also on the events social wall right now, as well as on Twitter. So you can go ahead and register following this. And again, yeah, we'll respond to as many questions as we can on the post-program resources. So I'm going to end on a high note because it is 4:20 after all. I want to just acknowledge that we have an opportunity here to create California with our institutions and our political frameworks to work together to advance for the common good. This is an opportunity for us to come together to create a better California. And Better California is actually an initiative led by the three regional associations. If you haven't joined, please do so. If you want to learn more about it, it's on the Philanthropy California website. It's an opportunity to really address all the inequalities and equity issues within our state across all the issues that we talked about today and all the other policy issues that we'll be talking about throughout the rest of the year. Just a quick thank you to our sponsors for today's events, especially our presenting sponsor, Bank of America, and our gold sponsor, the James Irvine Foundation. Thanks to the whole Philanthropy California team. It's been a joy working with all of you. This started last July and was supposed to be a big in-person gathering, and we quickly pivoted to this, and then we quickly pivoted from one platform to another today. So thank you so much. It's been an honor to work with the team and to be a part of the larger philanthropic community in our region and in our whole state. So this wraps it up. This is the end of our first ever gathering for the Philanthropy California Policy Summit. We hope to have one again next year. So I wish you all well. I wish that you stay safe and be sure to wash your hands. Thank you so much, and we'll all sign off now. Bye.
Thank you.
Thank you.